Sometimes doctors can scare you unnecessarily, and this can create anxiety and stress that could make your symptomatology worse. I want to present a case to you today that exhibits this exact thing. The case is a young female with no history of anything crazy medically, and she keeps up on herself every 3 months with her doctor to be evaluated to ensure that. Well, 4 days ago, she had sudden onset of numbness and tingling in the legs for no reason while she was laying in bed. She couldn't reduce it positionally. Exercise didn't help it or make it worse. It was just there. So let's document her story and see how doctors scared the heck out of her and potentially made it worse. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. So this young woman had sudden onset of numbness and tingling in her legs. Numbness and tingling is a neurologic symptom. Generally, it's created by assault, insult, irritation, loss of blood supply to a nerve. A good example is if you've ever fallen asleep on your arm. As you compress the nerves and the blood supply to the nerves in this region, the arm downstream goes numb and dead, and you wake up and it feels like a dead hand, and you can shake it, and as it comes back to life, it gets numb and tingly, and then it's back. Well, if you go the other way, as you're losing blood and nerve supply, numbness and tingling is like the crying out signal before it goes offline. So numbness and tingling is a neuro sign. It was in her legs only for a couple days. After 2 days, it also spread to her arms, both sides, in the forearms. So this is concerning because we have no history of anything ever, and then we have sudden onset of nerve signs in both legs that 2 days later spreads to both arms. So this, typically is a scary thing. So this person went to the ER. The ER looked at her and referred her to a doctor. The doctor looked at her and said, "I think it's MS," gave her her money back and sent her back to the ER. The doctor thinking it's MS without doing any diagnostic testing or labs, mind you. So that's not good to plant something like MS in a person's mind, in a patient's mind, without even doing any sort of evaluation. But he did. He sent her back. She Googled it and got freaked out. Okay? So the stress of that can exacerbate symptomatology. She went to the ER. They gave her anti-inflammatories, and she went home. That's our medical care, and it's terrible. Okay? And if a doctor makes an ignorant statement without doing any evaluation, diagnostics, or lab testing and plants a seed that scares the heck out of someone, that's even worse. So patient was sent in to me by people she knows that have worked with me. And so we sit down and I get this history from her and I say, okay, I understand why it can look scary because it's sudden onset, progressive over a short time, it's neuro symptoms. But it's unlikely in your age that it's MS, and without doing further testing, no one could say that that's it. Being both-sided and upper and lower sounds metabolic, maybe thyroid, maybe blood sugar, other things as well, but she has no history of anything. Her body type is healthy and fit looking. So I said, let's just see if it's something first physical. Is there an entrapment syndrome where nerves are being entrapped by muscles and downstreams being affected? Is there a misalignment in the spine that is impacting nervous system function and nerve function, leading to the numbness and tingling? So took her through a neuro exam. Everything checked out good. Dermatomes, myotomes, reflexes, everything's good, not a thing. I take her through some range of motion, some orthopedic tests, some things I made up to unique to her case to help exacerbate or relieve it. And we found some positional things that we could do to relieve the numbness and tingling in the arms by 33% in 5 seconds. In the legs, we did the same. So to me, those are signs that, okay, on exam we can reduce it positionally and with manual therapy type procedures. So that tells me it's probably more musculoskeletal and a lower probability of metabolic or autoimmune. So I took her through treatment, and after the visit, her leg numbness and tingling was completely gone, and her arm numbness and tingling went from a 6 out of 10 as she rated it to start to a 2 out of 10, so a 66% decrease in one visit. So that's great. That all points towards, hey, it's not MS. It's more likely something musculoskeletal that we found we could put an input in and change right away. Now what we need to do is see how things respond over the next 24 hours, etc., and see does it continue better, or how long does it stay better before it comes back? And if it comes back, how much back? All the way back to 6 out of 10 or just 4 out of 10, etc. And it may take a few visits to knock it out completely. So the point is, when you hear something from a doctor, if they haven't done anything but heard your story, not examined you, not done any diagnostic imaging, not done any lab work, then be careful to Google and set yourself crazy reading about the doom and gloom that you see on Google. That doctor shouldn't be planting that in your head without doing a workup. That doctor did nothing but took a history and shot from the hip about something that probably they don't know a whole lot about. So don't let them scare you unnecessarily, because that can lead to other issues. Get a thorough workup. If you go to an ER or you go to a doc and you don't feel like there was thorough workup, keep looking until you find a doc that performs a thorough workup and gives you information that seems to fit. If no workup is done and they're calling it something, that's really not good medicine. There should be a history, there should be an exam. If indicated, there should be diagnostic imaging and labs so that there's objective indicators to then diagnose from, not just shoot from the hip and be like, oh, sounds like this. And now you're scared and freaking out and making things worse. So that's my soapbox / case report today. Hope it helps you. Have a great night.